Altered Physiology, Mechanisms of Disease 2. This particular lecture looks at the cardiovascular system with a focus on heart transplant. Here in episode 6, focusing on heart transplant, we will document the indications for heart transplant, talk about factors that may affect one's eligibility to receive a donor heart, as well as some more novel treatments that are being used in individuals who require heart transplant, and then longer term outcomes once an individual has received a heart transplant. What you can see here on this particular slide is how heart transplant surgery is performed, in that the heart is cut so that it can be removed, and then the sutures or stitches are used to attach the donor heart to the great vessels. Now let's have a look specifically at indications for heart transplantation. And these are guidelines that come from the American Heart Association and also from another American Cardiology Society known as the ACC. And there are a number of indications which dictate whether an individual might be a candidate for receiving a donor heart. So let's look at the examples here. There's a long list of them. So for the first one is individuals who have what is known as refractory cardiogenic shock requiring a left ventricular assist device. So cardiogenic shock is a condition in which your heart simply cannot pump enough blood to meet your body's needs. Often this results from a severe heart attack. These individuals may require what is called an LVAD, or a left ventricular assist device, particularly in cases where perhaps a heart transplant donor heart is not immediately available. The left ventricular assist device essentially takes the place of a real left ventricle in helping to pump blood. Now, let's look at the second indication is cardiogenic shock with continuous IV therapy, such as dobutamine, which is able to stimulate the beta receptors of the heart. Individuals who have a very low cardiorespiratory fitness, classified as one's VO2 max or VO2 peak, and that's a VO2 of less than 10 milliliters per kilogram per minute. That is quite significant in that for individuals to be able to simply go about their daily lives and do simple activities of daily living, usually individuals would have a VO2 of at least 14 milliliters per kilogram per minute. And this is still far lower than the healthy adult who might have a VO2 of, say, around 40 milliliters per kilogram per minute if they are in their 20s or 30s. So we're talking about significantly decompensated when it comes to their cardiorespiratory fitness. They would be another population that would be indicated for transplant. Next, we have individuals who have a New York Heart Association heart failure classification of 3 or 4, despite maximized and optimized medical treatment. Another population who would be indicated for transplant would be those who have recurrent life-threatening arrhythmias, which originate in the left ventricle, despite having an implantable cardiac defibrillator known as an ICD, or being on antiarrhythmic therapy, or having ablation procedures to try to stop the arrhythmia. The next cohort that would be eligible for a cardiac transplant would be those who are in end-stage congenital heart failure with no evidence of pulmonary hypertension. So these are individuals, once again, who are born with heart disease. It goes on to progress to heart failure, and at the same time do not have pulmonary hypertension, as that might be a contraindication for cardiac transplant. Finally, the last population that is considered would be those individuals who have what is called refractory angina without the potential for medical or surgical therapeutic options. Now, a refractory angina is conventionally defined as very much a chronic condition, and that is when individuals have angina or chest pain alongside coronary artery disease, and it cannot be controlled by medical therapies or other types of surgery, such as bypass surgery or angioplasty. So these are all reasons why individuals might get placed on a transplant list. There are unfortunately many more individuals requiring hearts than there are donor hearts. And so that's why these types of criteria or guidelines have been established, as these individuals are clearly in need. But there are additional factors that are considered when deciding whether an individual should receive a heart transplant. So when it comes to age, generally patients should be less than 70 years of age. And if they are over 70 years of age, then they obviously have to be quite healthy when it comes to these other factors. Another contraindication would be obesity, and this is an eligibility criteria because obese patients generally have worse outcomes after cardiac transplant. So if you have a long list of people waiting to receive a donor heart, obviously there are certain selection criteria that have been met or should be met to ensure that the donor hearts can be um, useful in the long term for the recipient. Next, patients with a history of cancer may be considered for transplantation if the risk of reoccurrence is deemed to be low. Uh, Patients also require pre-transplant screening for certain types of cancer, such as breast cancer, colon, cervical, or prostate cancer. And the reason for this is that following the transplant, patients are given immunosuppressive type medications. And if you're suppressing the immune system, individuals, heart transplant recipients, are known to be at an increased risk of cancer because of their dependency on these immunosuppressive type medications. Next, certain comorbid conditions may preclude individuals from heart transplant, particularly if we think about patients with very severe diabetes, kidney disease, or vascular disease. They are not generally great candidates for heart transplant. Next, substance abuse. So smoking and recreational drug use are associated with worse post-transplant outcomes. I mean, there's a number of reasons I guess that could occur. One such a reason may simply be compliance to recovery and or the effects of smoking on the new donor heart. Now, finally, if we think about psychosocial considerations, patients must be able to be compliant with their medications and follow-up visits after transplantation to ensure that they're not having, for example, rejection of the donor heart, which obviously is fatal. The patient must also have adequate support from the family and community, as it is a very much a significant surgery and life process. So there are also a number of evolving areas of heart transplant, and so there was a review done that documented some of these novel areas, and so I'll highlight a few of them here. We have novel immunosuppressive agents to try to treat and prevent rejection, and so that is one line of research, particularly involving the uh, therapeutic agents that may be useful in preventing rejection. So, currently, immunosuppression is primarily targeted against the adaptive immune system, including your T cells and B cells. Now, I'll highlight another type of therapy that is being considered. So you could have a total artificial heart. And so researchers have developed a total artificial heart to replace a failing heart. And this has been done for several decades now, although it is very much a proof of concept matter. Some individuals will receive left ventricular assist devices. However, heart transplant is still preferred. Now there's xenotransplantation, which refers to the process of grafting or transplanting organs or tissues between members of different species. So you can see, for example, the transplantation of a pig heart to a human. And so With increasing numbers of patients who have end stage heart failure and a shortage of donors, there has been renewed interest in the possibility of this type of transplantation. Advantages include that you have somewhat of an unlimited supply of donor organs. You also are able to expand the candidate pool and avoid some of the detrimental effects on the donor organ function. The pig tends to be one of the likely candidates to replace human tissues. The pig tends to be very physiologically similar to humans and has a comparable organ size. So this humans and pigs tend to have a similar size heart. And it can be raised in controlled environments and, more importantly, genetically modified. And so this may help with things like rejection. And so this is one exploration area to try to increase the donor pool. Now let's conclude this lecture by looking at heart transplant outcomes. So in the long term, as I have mentioned, individuals who have received a heart transplant, they are often on immunosuppression medication for the rest of their lives due to the risk of rejection. And so that is one reason why these individuals are at an increased risk for cancer. But if we look at other outcomes, individuals with heart failure or heart failure and then have heart transplant tend to have significant physiological deconditioning. So as they're waiting for a donor heart and waiting for that surgery, they're often very, very weak, and so that is quite um, that is one consideration and quite significant. Individuals with heart transplant also have what's called chronotropic incompetence. And so their heart rate, because they have now a de-innervated heart, they do not have the typical innervation of the heart like individuals who have not had a heart transplant. Their response to, say, physiological stress, for example, is not the same. Uh, they cannot increase their heart rate to the same extent. They also tend to have higher resting heart rates as well. So there are some considerations for individuals who've had a heart transplant. What you can see here is the survival over time when we look at children who've received a heart transplant. So there's various graphs here which highlight the percent chance of survival over, say, 2 decades for individuals who've received a heart transplant during childhood. And once again, patients who are heart transplant recipients during childhood have often had congenital heart disease. So they're born with a heart defect and then require a transplant. But you can see that the survival is actually quite good in these patients for several years. And that concludes this lecture episode.